Okay, we are back again with a clinical conversation with Steve Kiak, who is our digital health manager at CORA Physical Therapy. And we have Ashley Langford, who is our director of clinical excellence at CORA and also our director at the CORA Institute for Clinical Excellence. Wait, did I say that right? Yes.
Sound good.
Close enough. It's on the shirt. Okay, and now this is good. This is where I'm going to try to get these two to argue a little bit. We're talking about, does telehealth or does RTM work? Does physical therapy through a computer, if you will, work? And I have a feeling that the conversation is going to go in the direction of, well, peanut butter's good and jelly's good, but peanut butter and jelly is better. And so, all right, with that, I don't know how to even light the fuse here, but Ashley, if I come in with a frozen shoulder, can you help me, or can Steve help me better? Who am I going to first?
So, first and foremost, as a physical therapist, my background and obsession is around manual therapy combined with your orthopedic exercise. So, saying that, I know my bias, right? Um, my general answer is going to be you're better off, particularly with an evaluation for something like that, to come into the clinic because you have an opportunity for a therapist to go through all the questions and the eval, but you also have the benefit of assessing for not only range of motion visually, but the feel for the mobility. So as a manual therapist, you're taught about end feel. Does it feel like it's bone hitting bone, or is there some give to it? And some of that can lead you down a path on how you want to treat the person. Having said that, I also fully respect Steve and his team, and I know their ability probably to ask questions subjectively, to connect with the patient. It's almost like when you lose one sense, you become better at others. That's the way I see it. So the reality is if you have frozen shoulder, depending on what type or how long it's been going on or how irritable it is, you might come in. I can do a very basic minimal evaluation, and I'm going to be reaching out to Steve and saying, hey man, I don't think Adam's going to benefit from being in the clinic. I'm just going to piss him off because it's painful. Can you work with him on just maintaining or whatever you can do? And in which case, so it's a great question. I'm going to tell family and friends typically try to get into the clinic for your first appointment. But it depends, who are you going to see? What type of therapist and background do they have? So, Steve, what do you think?
Yeah, and that's where, I kind of would take on the digital health side where, let's say your work schedule doesn't permit you to get in the clinic. Let's say it's a time-sensitive object. Let's say it's a motor vehicle accident and now you have a trauma and it's now leading to frozen shoulder. There's certain aspects where you might not be able to get there, and that's where my team can come in. You're going to get that care quicker, which is ultimately going to lead to a benefit and get you out of that pain. Whereas Ashley mentioned, there are certain time frames within certain diagnoses or plans that one might be better, one might be worse, and that's where the flexibility of digital health is optimal. And again, what matters the most is making that patient feel comfortable, making that patient feel confident in what they're getting as a clinical service. And that's where Ashley and I and our teams can complement one another. There's different skill sets and there's different avenues. No one approach is the right approach.
100%. Kind of diving into the topic, I'm thinking about some patients and prior experiences. For me, when I'm evaluating someone with frozen shoulder or adhesive capsulitis, one of the things that I, manually would do in the clinic, I want to assess for the end feel for the shoulder. Another thing is many times if it's early on, people actually have a spasm of the subscapularis. It's actually a muscle in your kind of armpit in the front of the shoulder blade that's your arm wrestling muscle. And for who knows what reason, it can be in a holding pattern. And that might be due to the fact that the joint is inflamed. It's causing that potentially. Who knows? But the reason I say that is there's been times where for select individuals, you can go through some manual therapy to relax that muscle, maybe some dry needling, and their range of motion fully improves. So you might dare to say maybe that was maybe a misdiagnosis or a pseudo frozen shoulder, in which case the in the clinic is beneficial. So that's one point of view and experience. But how many people are trained on using that technique and assessing for that? At the end of the day, if the patient either can't make it in and get to the clinic, or the therapist is not trained on that, you got to look at a variety of different factors. I would say always look to see what's the background of your therapist, whether it's digital like a telehealth or in person. Connect with the therapist to see how much are like their questions do they actually care about you, your well-being, your goals, right? I already know for a fact I could send a family member over to see Steve, and he and his team would be connected with whoever it is on the call. That's just who he is as a person and a clinician. So it's a fun topic. I think there's different ways you could go with it.
Yeah, and that's a great point. And I always like to think about it as a three-pillared stool. What makes up those three pillars? The patient value, the clinical expertise of the clinician, and research backing. So if you fulfill those three pillars, one can be a little stronger than the other or a little longer. That's what's going to make up a great care. Now, to Ashley's point, can I get and look at the patient's range of motion and get a capsular pattern and lead an educated diagnosis based off that and what the patient's physically telling me that they feel? Absolutely. That's the difference. There's different skill sets to what Ashley mentioned. Is one right? Is one wrong? Is one, who knows? And then that's where we can go forward with that. And that's that hybrid program where you don't have to be all telehealth. You don't have to be all in person. Could you benefit from a mixture? Yeah.
Yeah.
And Stephen, if I do have a misdiagnosis, are you able to do that without me being in person?
Absolutely. A lot of times, the scripts that we get from doctors, they don't even concern a diagnosis. It's shoulder pain. It's knee pain. So, a lot of our clinical skills is knowing what to pick up on. That is also verbally, but also visually. And then again, we give our best judgment, and then we have other tests to kind of confirm or deny it.
Is there anything you can't treat digitally?
A lot of yeah, so there are some specific things that we don't like to treat via telehealth, and that might be a high level stroke that just truly needs, for safety reasons, that hands-on and that extra care.
What about, we've done a lot of conversations about concussion, vestibular. Is that treatable via digital?
Yeah, so we've actually done a decent amount of vestibular. That's one that we kind of do rely on some in-clinic usage. Again, if we can't pick up on that nystagmus or that eye twitching back and forth because we can't get the right view via telehealth, that would be one that I'd say, hey, you might benefit more from being in the clinic than via telehealth so that they can get a closer look at it.
Yeah.
I got a question actually. I already know, Steve. I'm very interested to hear what you have to say because I'm sure y'all deal with this. As far as like muscle testing and strength, if we go to like the shoulder situation, it's an eval, and you're kind of like figuring out, is this really frozen shoulder? I might be wanting to know, let's do a quick screen of strength. Is it like a rotator cuff issue or something? What are some techniques or ways that y'all can assess for that?
Absolutely. So functionally, we always do the points behind here for range of motion behind the back. So that way we have a functional and physical assessment of that. For strength, a lot of the times we can test if it's a rotator cuff involvement, either special testing, full can, empty can. That's kind of how we rule it out. Even isometrics that kind of pinpoint if it's an internal or external rotation or anything like that. And
Yeah,
then looking at the quality of the movement tells us a lot about the muscle.
yeah, that's a great point. The end of the day, you'll see weakness because they can't actively move through full range of motion, right? I see that a lot at the foot where you ask them to grip with their toes. I'm going to check intrinsic toe strength, and they can't even actively go through the full range they have. So you already know, all right, there's something going on here. That's a great point.
Anything I'm not asking here? I feel like, well, okay, and anyone can do this, right?
Well,
So we talked
Adam,
earlier about go ahead, a senior population doing it, but I imagine anybody can do it, right? And can I just, if I have something happening, say at home, can I kind of like call in with Ashley, say, I just can't make it into the clinic. Is there a way you can connect me with Steven over my computer?
Absolutely. So that actually happened today with one of our digital health specialists. Um, there was a cancellation of a clinician called in sick, and they were like, okay, we have this eval that can't be seen now. We can either cancel it altogether, but digital health has that flexibility where, hey, do you want to go and have a telehealth evaluation? We can actually get you in at the same time you were scheduled and see you today. Well, they're now slid over to a digital health. We're getting that patient seen to start their care instead of waiting for a whole nother week to go by. And yeah,
Yep. I don't know about y'all, but I mean, I do that with my primary doctor myself personally. If it's a real busy day, I'll send him a quick message. Don't even have to call him now. Hey, could we make this a telehealth? And as long as he's cool with it, um, I just measure my weight myself at home and chat with him, and it's awesome. Very convenient.
Is this becoming more popular?
absolutely. Most insurances cover telehealth. It's a rare occurrence where they don't cover telehealth.
I don't think a lot of people know that. I don't think I know that. Maybe I do. Maybe I don't.
You're right.
I just think
You're
I
right.
think of it through a different lens, I guess. I think of telehealth as that's something we did during COVID. I should. It's funny. I wish they did telehealth
COVID
dentistry.
certainly accelerated the growth, right? But like in the rehab profession, we don't do a great job of advertising what we offer. In fact, I know coming out of school as a physical therapist, there was always those talks on like people know to go to the chiropractor for back pain, but like maybe not everyone, you step back 15 years ago, it was a little different to where we are today. And I think we're going to see probably something similar with the digital healthcare.
Yeah.
And I agree with that. COVID might have paved the way, but from the results that we got through COVID and what the patients reported back to us, that's what set the standard, and that's why so many more have adopted it. If you think about from a physician standpoint, digital health has been going on for years. Physical therapy and occupational therapy and rehab services are just catching up to the game now. This is why you're seeing so much more of it because they've already gone through this pathway. Now we're just joining on the bandwagon.
Do I need like sensors? Do I have to set my whole body up with like a sensor here, here,
Yeah.
here, so you can see how I'm moving, or is
You
that
would, Adam.
kind of
Yeah.
overkill?
Adam, only if you want to look like that, you do. But no, that is not a requirement. That is not needed. The technology now is so advanced that it can actually pick up a lot of that. And actually, certain platforms can already do that without having anything additionally on you.
I think it's fascinating.
So the
I'm only
question
going
is,
to do
Adam,
telehealth now.
who are you going to go see?
Yeah. Well, did you hear my earlier statement rather? I wish they did telehealth dentistry. That's one visit I just don't enjoy going to. Maybe in the future. All right. I think we that was good. Any other last statements on this or any last words?
I was super pumped to talk about this, Steve. Thank you for jumping on. This is a great topic. We're going to see it grow more and more. And at the end of the day, it's about access to patients, right?
Absolutely.
We do not have enough clinicians and healthcare workers to meet the need. This is such a wonderful resource to help with that.
Yeah, and I'm very passionate about digital health and what it offers to our patients and improving that access. So reach out to me anytime with any questions. I'd be happy to help.
And okay, so in closing too, I think that we can all agree one is not better than the other. One should not exist without the other. The peanut butter and jelly, the diet and physical activity.
I mean, we do have full telehealth patients too. So,
Yep.
Well,
Yep. You're right, Adam. Yep.
We'll let the patients make the decision at the end of the day, I guess. Unfortunately, in the insurance providers, right? But we're doing something about that, hopefully. All right, let's end this session. That was great. Thank you again for being on. Thanks for listening. We'll see you in the next episode.